I all hope each and everyone is doing well and good. And it is me, Dr. Amrita here. I'm not going to waste your time, just going so quickly. So today our topic is about surgery, the must know and important topics. And if you guys ask me what is the cheese and butter for this NEET PG, I'll definitely say that is going to be surgery as well as OPG. So if you know each and everything about the surgery, OPG, and all those short topics, short wala subjects is within your hands, I will say that yes, of course, 60% of marks are there with you. So next, only about the 40%. So today, the video all about the must know topics in surgery. You should not miss any of this topic. In case of surgery, I will say that you want to know in and out, and also if you didn't have that much time at you are late, I will definitely say that please don't never ever miss these topics, because this is going to be very important and the most important questions. Okay, so when you say about general surgery, I just want to say that start with GCS score, because 2021, 22, 23, there is always a question. Last time we haven't seen a question, so you can definitely hope for a question from GCS score. They will be giving a clinical scenario and you want to find it out, the GCS score, all time favorite. Then I have written everything in this paper. I will just dictate. First, learn in and out, that pneumothorax, voila, what is the sign, that barcode sign, that's all important. Okay, so this USG, voila, first study in and out. And also I want to say that all the newly things, machinery part, all new inventions like robotic, then that's monothermy, diathermy, that's all study. All those vacuum wala things, surgery, please learn all those things. As well as ENT also we discuss about tracheostomy. Here also please study tracheostomy in and out. For sure this time there will be a question. And about this raccoon eyes, that you will be knowing ACF, battle sign, middle cranial fossa, just that's all one liners. See, if you make a wrong question in this, like this, they were asked about raccoon eyes, where do you see? There is an anterior cranial fossa. If you made that question wrong, yes, of course, it is going to affect your rank, because this question, most of them will be knowing. And if you make a silly mistake here, what happened? Your 4 mark gone, your negative 5 mark gone. So this creates a big problem. Please don't do that mistake. Because of that, I'm saying that do MCQ practice also. Okay, then abdominal trauma wala is very, very important. All time favorite question, like when a person come with like blunt abdominal trauma. So what is the first way investigation, like that? So when you do this fast, when you see that fast is positive, what is that? Like stable. If the patient is stable, you go with CCT. Like that, if unstable, you go with what? Explorative laparotomy. Like that, there are certain questions is going to ask every time. Please do that also. And also I want to say that shock, there is a table wala. Please learn, like in what happens in hypotension, they'll be asking you like hypotension, bradycardia, warm dry skin, where do you see? That is what? Neurogenic shock. So in the table, there is like what happened in the pulse rate, all those things, respiratory rate, cardiac output. There is one chat box in the bill. Please do learn it. And the other table I want to say to you guys, like shock, voila, what is it, like class 1, class 2, class 3, class 4. Like that's all, that how much blood loss, hypovolemic shock, voila, there will be 31 to 40%, like BP low, hypotension, bradycardia, which class, like 1, 2, 3, 4, they were going to ask it. This table also there in the Billion Law. Please do learn it. Burns, actually 2023 there was a question, and that question like child's burn was being asked. So just read it. Okay, skin grafting is all time favorite question, that Wool's graft, Terish graft, please do learn it. Then that burns wala, that calculation you want to learn. So this liver wala you will be learning in medicine also, that child perk, MEL score. So what are the constituents? So where is bilirubin, where is creatinine? They will be going to us. So very, very important. Just learn all those things. If you can learn that calculation part in child, that is superb. Okay, they will be asking which, like is it A, B, C, like that. And also the other important is cannula, IV cannula color coding, very important. Like that, the Foley's catheter color coding also very important. There is a mnemonics like glory, gory, one thing. That's like 14, 16, 18. Please learn it, because these things you can learn easy. Okay, then central line, that pigtail, that is very, very important. That catheter, pigtail catheter, very, very important. Then Vacutainer, the colors of the Vacutainer. I have already explained in the path, though they might ask, like heparin, which color, like green, what is for, like is it ABG, like that. That color code, please learn in and out. Because in and out means there is nothing to learn. Just go and look the standard textbooks or any of the resources, you will be seeing in a box, which is for lavender color. What is the purpose? It's a must know question this time. They will definitely put one. Then yes, breast carcinoma, this breast part, everything learn in and out. That fibroadenoma, that popcorn calcification, where do you see that phylloid tumors, all time the examiner's favorite area, that microscopically what is being seen. They can link it with pathology, because breast you need to learn, and all those carcinoma, what is the treatment, how do you manage, it's very important. Please don't ever skip breast. Okay, then thyroid wala, also all time the examiner's favorite, that thyrotoxicosis 2023. They have asked a question like thyrotoxic, what happened, what is about the TSH, what about T3, T4, learn in and out. Thyrotoxicosis, papillary cell carcinoma, what kind of cells you are seeing, all those things. Okay, then yeah, okay, these are the must topics that you should cover. The trauma, just give more importance for trauma wala, that where do you, like all those things, the pneumothorax, how do you manage, and all those things is going to be very, very pakka important. Please don't skip it. Then I want to say that yes, bed sores, all time favorite. Last time was also there was a question, like they will give you the picture and they will ask you which, like is it 1, 2, 3, 4, what is the grading, they will be asking about the grading. You want to see the picture and you want to identify which grade it is. Okay, this is going to be very important. And okay, after general surgery, if you guys ask me urology or GI, I will say that start with urology, because urology is a favorite area for examiners. And urology, I should say you guys first learn this thing. Yeah, there is all time a favorite, like injury, what manhole injury, you'll be knowing, like a person RTA, what happened, he fell into a manhole, is it membranous or bulbar, that is very important. Don't go to exam hall without learning this bulbar or membranous. Try to identify which one is this. Please do MCQs, then only you will be able to understand. Then comes to foreigners gangrene, that is all time favorite, which is the organism, is it gram positive, gram negative, or is it both gram positive and gram negative. So what does this, very, very important, whether the testis is involved is a big question. Is testis involved in foreigners gangrene? No, testis is. Why this is not involved? Is it have a dual blood supply? Is it because of that? Yes, please learn it, please learn it. Yes, because of that, very important. Then hydrocele undescended testis, just that's all thing, just read it. Okay, so urology, yeah, and also carcinoma, penis, prostate cancer, that's also important. And also urinary bladder carcinoma is all time favorite, that metalloplakia thing they used to ask every time, like in ionicity model they used to put that area a little bit tough. So please learn it in and out. All those cancer vials is going to be very important. The other things, just like read and go. That kidney stones while I have already explained in pathology, please go with that. GA wala, I really want to say that that pancreatic carcinoma, that is going to be very important. That is Whipple's procedure. What is a procedure? Like in head and ampulla, pancreatic cancer, what surgery you will be doing, and all those things. Surgery part is very important, and GA surgery is actually important. It is better to learn in and out. Liver abscess also very important. 2023 they have asked a question, and they asked, like, gave a clinical scenario and what is the treatment, what is the management purposes, whether it's medical. So liver abscess, you already first start with medical management. Okay, then comes to surgery. There is a certain standard books that have written very well. Please do learn it. GA surgery, you want to look everything, because everything is going to be important. That is congenital hyperpyloric stenosis, CHPSS, that's all, so many things are there. Because GA surgery, guys, don't skip it, because you want to learn it. See, this last moment, if you're not able to read everything, I would say that go with the standard revision notes of standard neat things. You will be knowing which am I supposed to going to say. Please read that notes. Actually, if you have got marrow notes, this is not a paid promotion, but I will say that if you have got marrow notes, or if your friend have marrow notes, please do purchase it or ask them to give it. Yeah, and just read all those things. Revision notes of actually marrow surgery is going to be very good. Please read it and go. Okay. Then cancer part, cancer, anything they can be asked, like oral cancer, like tongue wala, that is oral salivary gland. There are so many tumors of salivary gland, that is Wartons and all those things. That is going to be very important. Please look all those things. Yeah, small cell carcinoma, BCC, and also that leukoplakia, erythroplakia. That's all things. And also, I really want to say to you guys, please never ever skip varicose. Very important. That is classification. That is what that CAP classification. That is where do you see that active ulcer, all those healing ulcer, and that what pigmentarous change, which is it, what is that C2 wala, they will be asking every time. That's going to be the very favorite question. Tracheostomy I have already explained to you guys. Yes, so this is going to be, yeah, if you guys want me to put some other topic also, I will just the surgery, some other important topics also. If you want me to go with that, I will go with. This is, I want to say that please never ever going to skip any of these topics which I have already said, because this is must not topic. And general surgery, do at least these things, and all those things, do the previous year questions, add with MCQs. GA surgery is going to be very important. Please never skip GA surgery. Voila.